Now, recently what we've been able to do as part of the research unit in South Africa is that with our collaboration with the scientists at Oxford University, we've been able to reach an agreement for them to actually provide us with a vaccine for us to actually see whether the vaccine actually works in the South African population. And that is important for multiple reasons, because the past experiences with other vaccines has been that when a vaccine works in one country or one setting, it doesn't necessarily mean that the same would occur in another setting, because we've got our own unique circumstances in the African context, which are dissimilar to what might exist in the United Kingdom, as an example. So it's critical that we actually understand whether the vaccine works in the local context. Now, this particular vaccine in South Africa, we're only going to initiate the study after they've completed the phase 1 study in the United Kingdom, which they've now completed. And now that they've completed it, what we're planning to do in South Africa is do what we call a phase 2 study, which basically, as I mentioned, basically measures determines the safety of the vaccine, but there's already data from the United Kingdom, which has enrolled more than 4,000 subjects, where there haven't been major concerns around safety. But in the South African study, what we're also looking at is whether the vaccine actually protects against COVID-19. And we sort of unfortunately positioned to do that simply because we're still at an early stage of the current wave of the outbreak of COVID-19 in South Africa. So we can expect many more people, unfortunately, that will get infected over the next few months. And that lends itself to us being able to assess over a very short period of time as to whether this vaccine does protect people against COVID-19. And if it does, it would have enormous implications, not just for South Africa, but for the African continent. Because as we've heard WHO pronounce recently, the continent which is now showing the greatest rate of increase of COVID-19 cases happens to be in Africa right now. And that is despite the limited testing that takes place in Africa. So it is critical that we actually determine whether these vaccines work in the African context. And if we're able to show that it actually works in the African context, that would arm us with the necessary advocacy tools to ensure that Africa gets access to these vaccines as early as possible.